Hey, Rukia, how are you?
Hi, Thomas. How are you?
Not too bad. And you, so you're going on vacation in July, right?
End of June to beginning
Okay,
of July.
okay. Can you shoot me an email, and we'll figure out. I know I saw an previous email, but since it's getting closer, we'll figure out a plan for when you're on vacation.
Okay, sounds good.
Thanks. Good afternoon, Jim. Aloha, Christine. Let me pull up the slides. Hey, Francis. Oh, no. Hey, Andrew. Hey, Tom. Dr. Berryman, thanks for joining us. Oh, let me put on my background. Yeah, glad to see some of you. I know you know it's been very busy end of the semester, rolling out vaccines, continuing efforts, Dr. Berryman. So glad to see everybody, and thank you for making the time to be here. We'll get going. Nothing too there some very huge news that will have trickling of some secondary tertiary impacts to our state, and the Pacific. So I'll go over that later today. Um, and then there's just so much more information than I was able to put together. So I'll kind of just brief that by exception today. So thankfully, last week we didn't have one, but it's clear trending. Japan is trending down, which is great news. I know the Olympics are coming up, so we'll see what happens with that. But good to see Japan going down. South Korea still staying relatively constant, so not too concerned. I know they have very robust mitigation efforts there. India continuing to trend down, though their variant is making its way around the world, and some new very new data is yet to be peer reviewed, suggesting that their variant is just as, if not more, transmissible, infectious than the UK variant. I think there was an op-ed in the New York Times today. So, still waiting to get more validity on that. But in terms of overall morbidity, mortality in India, definitely nice to see them trending down. Though it is worth noting that 164,070 average is still insanely high. So just to keep note of that. Really good to see our national overview. We are now at June levels in terms of our 7-day average. Though I heard some data that if you were to tease out the unvaccinated impact, it's still relatively high in terms of the burden that they're feeling. So once again, vaccines do play a big role in curbing this, but we're still nowhere near that 70% overall population as a nation. Arizona, California continues to stay stable, which is really good. Hopefully this will continue moving forward. Nevada, Texas, once again, similar trending down. They were starting off at a higher place, at least Texas was, than Arizona. Hawaii specific overview. Cases per 100,000 continue to remain steady. Percent positivity, Hawaii County did increase slightly, but once again, They were, I think it was just a cluster. I haven't had time to follow up, but I'm gonna pin it on that. But the other counties and the state overall, well under 2%. Vaccine administration continues to move at a pace that I think is manageable, but I believe we're slowly reaching a point of saturation. But the good news is that with the EUA for Pfizer, we still have a population to tackle in terms of the 12 to 15-year-olds. So looking to see more of that population become vaccinated, and no real issues with testing turnaround time as well. Similarly, no big increases in our Hawaii specific forecast, which is really mirroring the trend that we're seeing in our 7-day. Even with that 1 day of 120 cases, if you look at the average, we're doing quite well, and that's accounting for probable cases as well. So the science highlights this week are at a very high level, just because they are quite far-reaching. So WHO starting off, and then two from the White House, which will definitely have impacts for us as a state. So I think we're all become very accustomed to saying UK variant, Indian variant. I just did that earlier today. South African variant. And I think a big reason why the WHO is moving away from that is, one, to avoid stigmatization of those areas, and the other one is to just make it to level set and to make it consistent across everybody who tracks the variants. So alpha, beta, gamma, delta are for the variants of concern, and you can kind of see where they align. The Indian variant is the delta, and from what I've seen, it's made its way to the UK. What I will note is, if you're not aware, the Delta variant is variant of concern for the WHO, but the CDC has yet to identify that as a variant of concern by that particular organization. And then for our country specifically, the president is really making a push to get 70% of the population vaccinated with at least one dose, and really focusing on those under the age of 40. One of the lines is, if you get a shot this week, you can be fully vaccinated by 4th of July and really celebrate independence from the virus. And then initiative that is, I know that at least at the state level, we've really pivoted as well, but really getting away from the mass vaccination sites, and really trying to get at a more community-based level. So initiative at a national level is something called Shots in Shops. Really working towards the African American communities, getting into the barber and beauty shops and predominant in those neighborhoods to really get at a community level. And I know we've had similar efforts within the state. And then Lyft and Uber have free vaccine appointment rides to get the vaccine, and then at YMCA's across the country. I'm not sure here specifically, but it's great to see that they're offering free childcare for parents who are getting their vaccines as well. So once again, a continued push, because the data does really back it up that if you're vaccinated, you are truly at a decreased risk for COVID and also further transmission. And then just announced today, and this is huge for Hawaii because this really impacts a lot of the countries in and around the Pacific region. The strategy announced by the White House for the first 25 million doses of the vaccines, the Pfizer, Johnson & Johnson, Moderna that we have, to distribute. 75% of those initial doses will be sent through COVAX, which is the WHO distribution kind of effort to make sure it's an equitable distribution of COVID vaccines. And then you're targeting Latin America, Caribbean, Southeast Asia, and Africa. And then the other 25% of the initial doses will be sent to partners, neighbors, and countries specifically experiencing surges. So really good to see, setting the stage for increased global coverage. And we've discussed on this forum multiple times that, while Hawaii is doing well, and you saw the data, you saw the 70 averages for the state, for the country, and for some of our sister states. We really can't feel comfortable. And Dr. Desmond, State Lab Director, last week said in a Civil Beat article, we really can't feel comfortable until the rest of the world really gets it under control as well. And we're still seeing variants, and we understand, especially Hawaii being a high traffic, high tourism destination, that, even with the testing, there are still possibility for cases to slip through. So it's good to see that our country is assisting global vaccination efforts. And then the other positive news point from this press conference was, at least at a national level, we're preparing for surges and to prioritize healthcare workers and other vulnerable populations. So once again, really making a concerted effort to really increase the public health capacity with vaccines. And then some other tidbits that didn't make its way here, but there have been initial studies, and we're waiting for more than just a preprint, but they're looking at clinical trials and studies that are mixing and matching vaccines, COVID vaccines specifically. And I know there were some questions that were posed in this forum and in our working group that, eventually what might it look like, you got Pfizer for a first shot, but let's just say you ran out. Can you get a Moderna, or you get a Johnson & Johnson, and mixing and matching these COVID vaccines? And we're now at a point where researchers are looking into it, and that's only going to increase the flexibility with which we can deploy the vaccines to not just the rural communities, but writ large within the state and nationally and globally as well. So I'm glad to see Dr. Abe, our resident pharmacist. I don't know if Andrew, if you've read or been tracking that, but I kind of Googled that quickly last night and did see some preliminary data on that. So I don't know if you have anything to add, but and not to put you on the spot, but that is exciting because that's showing that we're reaching more of a status quo in terms of how we are approaching the vaccination efforts. Similarly, like we do with all of our other vaccines, we don't really pay as much attention into which influenza vaccine are we getting, are we mixing and matching our other vaccines. We don't really care about that because we just accept what we're getting is what we're going to get. And I think hopefully that's where we're moving towards with COVID and the COVID vaccines. We're just not quite there yet, but we are making our way there. So that's all I have for you guys for this week for the update. I believe some other updates. Moderna did submit. I don't know why it didn't make it. That is a big thing. Moderna did submit their data for full approval earlier this week, a couple weeks behind Pfizer. So Pfizer did submit theirs a couple weeks previously. So from what we're hearing, and Andrew, please correct me if I'm misspeaking, but we're looking at early August for the CDC. For the FDA to make their final decision. We were hoping earlier, but because it's full approval, it may take a little longer. I'm not as familiar with that process, but now both Pfizer and Moderna have submitted for the BLA or the full approval, and then they also submitted for we're expecting Pfizer to submit for the younger population. And what we're hearing is later on this fall, I think the younger keiki to get EUA approval. So that's all I have for the update. Question from Jim: will HiPAM or Butler Labs continue to work to identify viruses and variants in Hawaii? Marguerite, thanks for joining. I see you on, so if you want to take that, Dr. Berryman, if you want to speak to the state and the state lab in terms of the continuing work to identify the variants in Hawaii. So, both Dr. Butler and Dr. Berryman, whoever wants to chime in first, if you want to answer Jim's questions.
Hey, can you hear me? So
Yep.
thanks for the question. Yeah, they're continuing to identify variants and going at a pretty good rate. They have experienced, I don't know if you've heard about the pipette tip shortage. That's an issue. And so we are working on we're going to be assisting them to keep their throughput going. So yes, we are all working together to try to keep it going.
Awesome. So I guess that answers both the Butler lab and also the state, working together, which is what we'd love to see to really support the state capacity for tracking. A question from Tom. I know we're in the wave for inter-island travel without COVID-19 tested vaccinated. Yep. Any news on Hawaii will deploy for mainland travelers? I haven't. I've heard rumblings, and I hesitate to speculate because, I'm outside of the loop for the state. So I will refrain from making any comments. Dr. Berryman, I don't know if you have anything, but I know that there's a push, at least from what I've seen in the news, from the lieutenant governor to really make this applicable for mainland travel to Hawaii, but I'm not privy to state discussions at this time. So great question, Tom. I'm not sure if there's anything, or if Dr. Berryman is at liberty to discuss, but I'm sure it's being discussed already. I just don't have any fidelity on that. But what I will say is, a good point that Dr. Berryman brought up previously is it is very easy to manufacture your own vaccine card. So, and I know I'm sure not just our state, but other states are concerned about that and really working to find solutions to validate someone's vaccination card. So I'm sure more to follow. At least at a national level, they're looking at contracting that out to private entities, and we'll continue to wait with bated breath to see, because I'm sure everybody does not enjoy getting something stuck up their nose. And then thanks, Andrew, for the thanks, Marguerite. Oh my God. The bioinformatics person is producing variant reports plan to release biweekly. Yep, and I know we've said that previously. And then thanks, Andrew. BLA has been submitted. Yep, it'll take a few months. Okay, so hopefully sooner than later. And then I know we discussed previously the ramifications, and our resident legal expert Jim has kind of commented on the possibilities of private and public entities kind of taking that guidance and running with that. So we'll see. Oh, from the grapevine around June 9th, some announcement may come out. So next week. So we will stand by. Thanks, Francis. So we'll just keep on watching and waiting, and seeing what happens. Janet, I don't know if you're able to respond, but a question from Tom: is Kauai still requiring COVID-19 tests for mainlanders traveling between island if they are vaccinated?
The inter-island, can you hear me?
Yes, we can.
So the inter-island travel requirements are the same for every island except for Oahu. Kauai doesn't have any extra requirement. So the requirement currently is that you either have a pre-travel test or that you show your vaccination card, if your vaccination card includes at least one vaccine from within the state of Hawaii. If your vaccination card is entirely from the mainland, then you have to have a pre-travel test for inter-island travel, and that's not unique to Kauai.
Thanks, Janet. Awesome. Love all the questions. Any other questions, comments? The past couple weeks have been kind of a lull in terms of major COVID news, which is good. I will take that anytime. But I think, from a epi point of view and a glass kind of half full, I think Memorial Day is our first real test of how successful the vaccine is with human behavior, not just as a state, but as a country, because a lot of the policies were loosened out right before Memorial Day for those who are vaccinated, especially with the mask guidance. So I think we'll see in a week, we can change if there's any impact from that. So just my perspective on what I'm kind of looking out for. Okay, I'll wait a little longer for any other additional comments. Or questions. Okay, we'll call it a day for our Thursday. Thanks. Baby's doing awesome. Definitely putting on some weight, thankfully, and sleeping a little longer, but not as long as my wife and I would like. But I think that's just an uphill battle that we'll be facing for quite some time. But definitely not in that zombie state anymore. Thanks for checking in, Lee. But yeah, thank you everybody for your continued participation and interest in HiPAM. I think, you know, you're seeing us kind of slowly shift what we're focusing on, and I think we have some long-term efforts where we're slowly working on and hopefully can have an impact not just on COVID short-term, but the long-term and capacity for the state. So stay tuned for that, but have a great rest of your Thursday. Have a great weekend. Stay safe, and we'll see you guys next week. Thank you, everybody.